I discovered a badge in the hospital billing system and used it for 3 years before anyone realized what was happening. During my nursing residency, I accidentally discovered something. While processing EFT, our hospital's billing system automatically marked anything under $12 as administrative write-off if you checked a specific box combination. These small charges would disappear from patients' bills without even any flags. I didn't think much of it until I met Mrs. Rodriguez, an elderly woman who came in monthly for diabetes care one day. She was counting change to pay for her bus ride home. When I asked if she was okay, she explained that after paying for her needs, she had to choose between bus fare or lunch. That night, I couldn't sleep. The next day, when processing her S-bar, I remembered the billing code. I split our $30 copay into 3 separate $10 entries and checked those special boxes. Just like that, her copay disappeared. What started with Mrs. Rodriguez became my silent mission. I began identifying patients who were clearly struggling, the ones rationing durations, missing appointments because of bus fare, or choosing between medical care and groceries. For these patients, I'd carefully split their copays into sub-$12 increments and make them vanish. I was meticulous. Never did it for the same patient twice in a row, never processed more than a few per week. I kept mental notes of who I'd helped to avoid patterns. One day, I was called into administration. My heart raced as I sat across from the financial director and my supervisor. They had 2 nates open. "We've been reviewing billing anomalies," the director began, sliding a paper toward me with many patient names of all people I'd helped. "I can explain. I started already advocating losing my license." My supervisor raised her hand to stop me. "The hospital's charity care program is severely underutilized. These patients you flagged, they all qualify for full coverage under our existing programs." They weren't angry. They were implying a new system where nurses could refer patients directly to financial assistance, bypassing the complicated application process that many patients couldn't navigate. "We need more advocates who notice these gaps," the director said. "Instead of working around the system, we want you to help us fix it." They created a new role for me, ADL Skaters Hun Hadding Educate, ADA, where I split my time between nursing and helping patients access assistance programs they never knew existed. The hospital ended up writing off far more than my little $12 charges, and importantly, patients got consistent care rather than my random acts of billing kindness. Years later, I ran into Mrs. Rodriguez at a community center where I was giving a diabetes management workshop. She was volunteering showing newly diagnosed patients how to cook affordable, healthy meals, She told me when my copays mysteriously disappeared that year, I used the money for nutrition classes. Now I teach others. She went. Some edges in the system turn out to be features, not bugs. Sometimes the biggest changes start with the smallest acts of rebellion. And sometimes the system isn't broken because of the rules themselves, but because nobody showed people how to use them properly.